And in the recent 8 days, we have received over 100 million receivers of the vaccination. So that's about the status quo of our vaccination. And to answer your questions, we have invited Deputy Director General Wu Liangyou from the National Health Commission, from Guangdong National Health Commission, Mr. Duan Yifei, from the CDC Epidemiology Chief Expert, Mr. Wu Jianyong, and from the CDC Vaccination Planning Chief Expert, Wang Huaqing, and also a research fellow from CDC, Mr. Shao, and they will take your questions. Now the floor is open. Please identify yourself and raise your hand. The first question goes to the second gentleman in the first row. Thank you. From the People's Daily. Now, in Anhui and Liaoning provinces, epidemic prevention and control must be stepped up. What is the situation? And what are the new learnings from those cases in the two provinces? Mr. Wu Liangyou, please. Thank you for your questions. Recently, in Liaoning and Anhui provinces, we've seen some clustered confirmed cases in the locality. Since then, the National Health Commission and the Disease Control and Prevention Bureau have dispatched 2 stationed teams to the localities to guide the prevention and control efforts. Right now, the different measures are being carried out in an orderly and forceful way. In the 2 provinces, they have convened several pressers to brief the general public about the updates. In the past 1 year, China's epidemic control and prevention maintained steady, and in the majority of localities in China, there had been no outbreak of the local cases. In some minority areas, they have dropped their vigilance. So this new round of the confirmed cases is an alert to us that the epidemic is still around us. Internationally, we have some severe situation, so rising pressure is upon us about imported cases and making it more complex for our epidemic control and prevention. So our mechanism of epidemic control and prevention will face a lot of uncertainties and complexities, so we can never drop our vigilance. We call upon the whole society to elevate their awareness of risk prevention and have a clear mind about the situation. The low risk domestically doesn't equalize with zero risk, so we must continue to implement the sorts of measures of prevention and control and work actively with vaccination campaign so as to safeguard our hard-won achievements of epidemic fight. Thank you. As Director General Wu said, low risk isn't the same as zero risk. Next question, please. From CMG, what are the sources of the cases in Anhui and Liaoning provinces? Where are the viruses coming from? Are they mutated? And are those people having contact with the foreigners from abroad? So are there any asymptomatic carriers? What is the size of this new round of epidemic cases? The questions go to Wu Zunyou. Thank you for your questions. We have no locally transmitted cases recently. So the viruses must have come from overseas or the polluted objects. We are still working on the sourcing. For the cases in Anhui and Liaoning provinces, we've looked at their gene sequencing. The cases are the same, so they belong to the same gene sequencing and the same transmission channel. There will be no sustainable asymptomatic carriers this time, so the possibility is very low. Usually, the asymptomatic carriers have frequent contact with the confirmed cases. Usually, for example, they live together in one family or they work together for a very long time. And in addition, asymptomatic carriers will not give birth to first generation or second generation viruses. Without any clinical case, even with the second generation of the viruses, they will come to an end. On May the 14th in Anhui provinces, there were 10 reported cases, but as to the antibody, they were negative, which means they had been infected for a short time period. Usually, there will be a certain incubation period, and based on the situation, in Anhui and Liaoning provinces, the scale will not be that serious as it was in early this year. But we still must be aware about our prevention. Our common people must be committed to all the prevention measures. Next question. From the finance channel of CMG, we are very concerned about the potency of the domestically developed vaccination in terms of the imported cases, for example, from India. And what about the processes and techniques of those newly developed vaccination? Thank you for your questions. Now, we are paying close attention to those mutating viruses in India, but there have been no clear data yet. We just want to brief our general public that certain research institutes and enterprises in China are already studying those mutating viruses in India. And according to the initial research, our current vaccines are able to protect our people from those mutating viruses. Secondly, in the mutating process, there will be a lot of uncertainties. If our vaccines can never respond effectively to those genes, China still has some other resort. For example, we can maintain our previous processing techniques, but our products will be the brand new vaccines to respond to those varied genes. So there will be some new vaccination coming up in the future. Thank you. From CMG. In this past 1 year, we've seen that most of those new confirmed cases are from the coastal cities, and Guangdong is also a coastal province with a long coastal line. We've learned that in general, Guangdong province maintained a steady control of the epidemic. So as to preventing the imported cases from overseas, what are the measures specifically in Guangdong province? Mr. Duan Yufei, please. Thank you for your questions. Guangdong province has seen 6 imported cases. Those are correlated, but within 7 days, we've scientifically handled them with no further spreading of the cases. To sum it up, early discovery, early intervention, and targeted control are the key. As to early discovery, we've done 4 measures. Firstly, in our province, we've invested 2 billion RMB yuan to establish over 400 clinics for fever symptoms to cover 1,000 cities. So, in the fever clinics, we can cover all the districts and counties and villages. We also urge different localities to strictly implement the accountability system and follow up the epidemiology. Thirdly, we require those hospitals with no fever clinic or department, village health stations, to receive no fever patient. Fourthly, coordination mechanism. As long as we discover any fever case, we must refer the data to the disease control and prevention departments or bureaus. And secondly, we also have nucleic acid testing on a large scale. For all the patients with fever symptoms, we must go through the nucleic acid testing process. For those patients, we must collect their samples instantly and report back the results of the testing. Over the past 400 days of epidemic fighting, we've been committed to those measures, and our reporting system and evaluation system remain relevant. And in our province, as to the subjects of our testing, we have further expanded the categories to 21 different types. For example, the truck drivers or staff members in the cold chain or the other relevant personage, we put them into our listing of nucleic acid testing. Every day, we receive about 250,000 to 300,000 people for nucleic acid testing. Thirdly, we have quick response. We divide our whole province into 6 regions. In every such region, there will be an on-site working group, and there are 6 working groups. The chiefs of those working groups are assumed by the Provincial Disease Control and Prevention Bureau staff, and under the 6 working groups, we further divide them up into 7 special committees. For example, epidemiology group, the sample taking group, the medics team, the monitoring team, the TCM treatment team, and also psychological help team. Our working groups require a 1-hour instant response to any reporting. And together with the Public Security Bureau, we carry out the investigation and the prevention together. We also have targeted measures. We have targeted management of the key prioritized groups. In the screening process, we will go to those close contacts for screening. And secondly, we go to the close contacts of the close contacts to diffuse any risk, and then we further scale up the prevention and control. And also we have the pathology sourcing measures. Such a sourcing mechanism is incorporated into the handling of all patients, and we also intensify our monitoring of the certain viruses. So we've discovered the mutating viruses from South Africa, Brazil, India, and UK, respectively, in our province. Recently, for every imported case from overseas, we will step up the sample taking and review work and analysis so as to be always sensitive to any mutating viruses. Next question, please. Thank you. My question is there any change about vaccination policy in Guangdong province? And in the next step, what will be the other arrangement and policies, particularly for those mutating viruses? Thank you for your question. Guangdong province observed the national instructions. We have further improved the ratio of vaccination. By yesterday, the total vaccination numbers was about 3.92 million. And among them, over 10 million people have completed 2 vaccinations altogether. On April 27th, there were about 1.32 million vaccinations, and on May the 14th, there were about 1.5 million vaccination. As to our future steps, as to the vaccination policies, we have different batches and different segments. We break our province down through the different categories. For example, coastal cities, their frequency of exchanging with other countries. There are 3 different categories. So for the Tier 1 cities, there were Zhuhai, Guangdong, and Shenzhen provinces. And in Tier 2 cities, there are 7 cities, and then there are Tier 3 cities. So when there is a shortage of vaccination supply, we lean more towards Tier 1 cities. Once the vaccination supply goes up, we will turn more towards Tier 2 cities and 3 cities. So we have such a categorization of vaccination. And also for different municipalities, they also have to break them down into 3 different layers of regions. We pivot towards the highly risky areas and people. Secondly, we have security measures. Usually for the vaccination entities, there are 2 categories of them. For example, the designated entities standing at 2,289. We also set up some temporary vaccination sites at around 800. Among them, we also establish 60 fixed designated vaccination sites to help the compatriots in Hong Kong, Macau, and Taiwan, and foreigners. Based on the capacity of different vaccination sites, we dispatch about 150 vaccines for each site, and the total vaccination goes to over 2 million. For some larger vaccination sites, there may be 200 vaccines happening one day. So I think we have a strong capacity of offering vaccines in our province. And also we have organized training on many occasions. We dispatch the provincial experts to different sites for guidance in order to maintain an orderly vaccination. Thirdly, our distribution of the vaccinations are immediate, and we allow for no warehousing of vaccines. For every batch of vaccines arriving in Guangdong province, it takes us only 2 days to send them out, so there is no storage of the vaccines. As long as there is any national plan and we receive the notification, we will instantly give the orders out to different municipalities. Then the municipalities will learn when they will receive what amount of vaccines. Fourthly, our vaccination services are convenient for the general public. With the informatization support, we have some small applet so that the England residents, Hong Kong, Macau compatriots, and foreigners can receive the vaccine services alike. After vaccination, there will be an applet called 月见通 to notify the vaccine receivers to get a second vaccine at an early date. And also based on the demands of the people, there may be some appointment services able to their doorsteps. For the foreigners and Hong Kong Macau compatriots, there will be some English language services and science promotion. We will assign some medics who can speak English or Cantonese to offer services on the sites. Thank you. Next question. From the health newspaper, according to some feedback, after receiving 2 vaccines, they discovered that the 2 different vaccines are belonging to 2 different producers. So will such a mixture of vaccines undermine the efficiency of the vaccines? And one, can we accept such a mixture? those two vaccines must belong to the same technical line. The main reasons are, for example, the shortage of vaccines. We've done a great deal of scientific research before, so accepting another vaccine from a different producer but on the same technical line will generate similar results and outcomes, and the safety is no issue. Internationally, we've read some data stating that vaccines of different technical lines may be mixed for usage together. Such a mixture of vaccine usage is to realize stronger and more sustainable vaccination effects. But now we haven't received the approval from the NMPA, so we are still accumulating data, and China is still in the process of research. Does Hua Qing has anything to add? All right. For the marketed vaccines, there are 3 types of inactivated vaccines, one other for emergency use, one other with the protein composition. One technical line belongs to the protein subunit, and those different technical lines may have different features. That's why some vaccines will have 3 times of injection, some others have 2 injections, because they belong to different technical lines, but we can guarantee the safety and security. So what will be the occasions for the mixture of different technical lines? According to the guideline of vaccination, there is one requirement for the mixture usage. In principle, we advise to be vaccinated by utilizing the vaccines from one same producer or one same technical line, be it 2 injections or 3 injections. But if the second injection or the third injection is not available, for example, I accepted the first vaccine in one locality and then I moved to another locality, and the new place has no supply of the previous vaccine. What can I do? As I said, with no supply or no availability of the previous vaccine, we will substitute it with another vaccine from the same technical line. So by that I mean you must accept the same technical line, for example, inactivated vaccine or the protein subunit vaccine. But some vaccines cannot be mixed, for example, with no research confirmation. If you have accepted the first injection with the inactivated vaccine, you cannot be injected with the others. If the several injections belong to the same technical line, it's acceptable, but the best is to accept the same products from the same producer. Thank you. Next question, please. From Xinhua News Agency. Vaccination is the most effective means to fight against the epidemic, and China is stepping up the vaccination, particularly in the recent days, due to the outbreak of the confirmed cases in Anhui province. So, what is the phenomenon of explosive vaccination needs mean to us? Mr. Wang Huaqing, please. Thank you for your question. As you have mentioned, receiving vaccination is the most effective measure against infectious disease. and vaccination must be accessible. And vaccination is convenient right now. That's why, as long as there is a supply of vaccines, we will advise the vaccination as the proper means. As you said, in Anhui and Liaoning provinces, recently there is an outbreak of new confirmed cases, and the population over there are quite voluntary in receiving vaccination. So once there is any positive case occurring, we will be reminded that the risk of epidemic outbreak and transmission is always around the corner. We can never lose our sight of the possible risk, and in addition to maintaining the existent prevention and control measures, vaccination is the top one choice for us. In general, China maintains a good control outcome, leaving us some room of vaccination before the transmission. So against such a backdrop, we must orderly promote vaccination with certain priorities. So my warning to the public is that before the positive cases came up, as long as you have the opportunity to receive vaccination in your neighborhood, please actively apply for the vaccines. Then, with our immune systems in place at an early date, every citizen has honored their responsibilities in preventing and controlling the epidemic. And also, FYI, it takes time for the vaccination to work against the infectious disease. So don't wait until the confirmed cases are rising in number. After all, in China, the vaccination is promoted nationwide with certain priorities and sequences. So as long as it goes to your place, please voluntarily apply. Thank you. Next question. From Hong Kong Economic Newspaper, my question is to Wu Zunyo. We still have continued imported cases, and we also see some local rebound of the epidemic. So what will be the measures for the prevention and control in the future? Thank you for your question. From the angle of epidemic prevention and control, every citizen must look globally. With no local transmission of epidemic, although as long as the epidemic has not been successfully controlled abroad, you must stay alert and take it seriously. That's why our routine prevention and control mechanism must always be in place. Please put on your facial mask when going out, particularly with a gathering of population. It's just like taking your keys and cell phones when leaving your home. Facial masks must be a necessity. If you have stayed by the rules of prevention and control mechanism and travel to a new place with reported cases of the epidemic, as long as you wear your facial mask, you will not be the transmitter of the infectious disease at least. So, always wear a mask is very important. Globally right now, vaccination is encouraged. So, just like putting on the facial masks, please get a vaccination early. Next question. According to the local prevention and control measures, now all of those imported cases or the first and early cases happening locally, there must be a gene sequencing process. So what is the situation of gene sequencing? What about the capacity of different localities in gene sequencing? The question is from China News Service. And Mr. Wu Liangyou, please take the questions. Thank you for your questions. You've mentioned about the 8th version of prevention and control measures. Please allow me to give you a brief introduction. In this measure, we have summarized our experience in prevention and control in combination with the international changes and researches of the epidemic. So in the 7th document, we have revised it further to come up with the 8th version. We further improved the overall requirements of prevention and control and strengthened the organizing capacity, vaccination monitoring, prevention and control in rural areas, the quarantine and observation efforts. As you have mentioned, for all of those imported cases and first and early cases, locally, there must be gene sequencing. That is one important part of our gene monitoring work. The whole genome sequencing effort is mainly aimed at discovering and analyzing the sources of the infection early. In our mechanism, we keep talking about sourcing. So the gene sequencing is to support sourcing. Also, through gene sequencing, we can have a dynamic monitoring of any possible mutation of genes, paving the way for our future testing of the viruses and the protection of the vaccination effects and readjusting the prevention and control measures. Ever since COVID-19 broke out, localities have stepped up their gene sequencing capacity and training capacity. In addition to CDC and other national organs nationwide in 33 provinces and Xinjiang province, they have been equipped with the whole genome sequencing capacity. Thank you. Next question. Thank you for the opportunity. I am from China Business Network. I've seen an explosive growth of vaccination in the recent 1 week. So with the speeding up of vaccination, how can we guarantee the standardization of vaccination procedure and its safety? Mr. Wu Liangyou, please. Thank you for your questions. For our general public to be equipped with vaccination and immunization, different provinces are speeding up the process of vaccination. So with the acceleration of vaccination, the National Health Commission has required localities for many times that the vaccination procedure standardization must be the first thing, and they must have considerate arrangement of vaccination. Firstly, they must comprehensively improve their vaccination capacity with precise control of the vaccination time, the number of people, and there must be informatization, cold chain technologies, and the logistic support, and the information system must play its role in the vaccination distribution and transportation so that we can have accurate measure about the storage of vaccines. And thirdly, we must arrange certain medics to be on the site for the vaccination. There must be training of the medics so that every trained member are proficient in vaccination and first aid, so that there must be screening and reviewing process. Once there is any adverse effect, those trained staff members will have an instant response. Fourthly, we organize the general hospitals in Tier 2 levels to take effective measures. For every vaccination site, there must be stationed medics in place, and there must be first aid equipment and medicine. There must be the ambulance and the transfer channels and vehicles, and also green channels. To further promote the vaccination process, the Joint Prevention and Control Mechanism panel has dispatched experts to different localities to improve the coordination, efficiency, timely solving the problems of vaccination in the localities. For the premium experience, we also disseminate them nationwide. Thank you. Next question, please. From CMG, now nucleic acid testing is still one important criteria for screening. And as the prevention and control of the epidemic is standardized work, we must prepare for the next round of nucleic acid testing. My question goes to Mr. Duan. What is Guangdong Province's plan about nucleic acid testing? Thank you. As prevention and control is becoming a routine, we have been tightening our efforts of nucleic acid testing. We will work on the following fronts. Firstly, continue to improve our testing capacity and our services. In April this year, there are about 740 hospitals and medical institutions with the testing capacity. The maximum daily testing will be about 2.28 million per day. There will be some disease control center and also the infectious disease hospital equipped with the testing capacity, so we can have 100% coverage. And also we offer appointment services so as to avoid the high rush hour of testing. And we also have online payment, online testing services, and also the notification online of the testing results. We also have a contingency plan by the measurement of districts. As long as the city has a population of lower than 5 million, we will invite the third party so that we can finish the testing of nucleic acid of all the population within 2 days. For the cities above 5 million population, we allow for 3 to 5 days of 100% nucleic acid testing. Also, we have a guerrilla team of nucleic acid testing involving 1,200 medics for testing and 2,200 of sample takers, as well as a lot of equipment and facilities. So such district-based resource base is very important. As I introduced, we have divided our whole province into 6 regions. The whole province will be responsible for the disbursement and arrangement of nucleic acid testing. As long as in one city there is an outbreak, we will send out the nearest team to help it out. We also have stringent control and management so as to detailize our implementation. Recently, our nucleic acid testing in Guangdong Province has identified 21 categories of tested people. There will be instant testing, timely testing, regular testing, dynamic adjustment of the testing. And also, we stringently implement the lab access and management requirements. We also enhance our quality control in the labs to guarantee safety in the labs. We also improve nucleic acid testing quality systems in the province level and municipal level. And also in the whole province, we have boosted the capacity of nucleic acid testing and quality control by dispatching the biology experts to different localities for guidance. Next question, please. From China Economic Daily, recently, as has been announced, as long as they receive the vaccination, they don't have to wear the facial masks in the US. And this phenomena happen sporadically in China. So what's the suggestion about wearing facial masks? And for the children, some people may worry about their ventilation issue wearing facial masks. Maybe when they take the facial mask off one day, those children's nose will be more sensitive. Is that so? Mr. Wu Zunyo, please. Thank you for your questions. Vaccination is the biological response to the epidemic. Wearing facial masks and keeping a social distance is the public health measures against the epidemic. Those two are complementary. They are not against each other. When all the population are not immune to the epidemic, even though you have been injected with the vaccine, you still have to wear the facial mask. So it has nothing to do with whether you have injected vaccines or not. Wearing the facial mask is beneficial for the families and the whole society. As to the role of the facial mask, it is to defend against the particles in the air and the viruses attached to the particles. In that way, we can avoid being infected, and the ventilation issue for the children or for the normal adults is no problem. At least not because of wearing the facial masks. It will not lead to more sensitive respiratory system. Wearing a facial mask will only deliver benefits with no harm at all, so don't worry about it. Next question. From the cover news, some public has given the feedback that there has been a situation of 2 people sharing 1 bottle of vaccines. Will that dosage be enough, or will that undermine the effects of the vaccines? Mr. Shao, please. For the 2 injections, vaccines, and 1 injection, vaccines, in terms of the ingredients, the raw materials, producing area, and the other parameters, they are exactly the same. The only difference is about the dosage, whether being 1 dosage or 2 doses. As long as 2 people share from 1 dose, don't worry about it, it's enough. For those vaccines exported from China, usually there are multiple doses, even including 4 injections or 5 injections. We can reduce the transportation pressure and spread out the vaccination internationally with the Chinese contribution. Next question. From Beijing Broadcasting Television, I have a follow-up question. For 1 dose to be used by 2 people, is that an individual situation by some certain producers, or such a phenomena will be commonplace among different vaccines? Mr. Shao, please. Thank you for your question. The inactivated vaccines were firstly used with multiple doses. Under the circumstance of security and safety, we have transported the vaccines in different batches to cover more people. This has been verified by the enterprises. If some producers, with the progress of vaccination, has the need, we will have to approve the different batches of the vaccines. We've done it partly before, as long as those different doses of the vaccines are needed in some localities, we will offer them internationally. Next question. From Lichi News, some media reported that the earliest case could be sourced to the Labor Day holiday in this round of outbreak, and the Dragon Boat Festival is around the corner. So, what suggestions do you have for us? Mr. Wu Zunyo, please. Thank you for your question. In this round of epidemic in Anhui and Liaoning provinces, you must have read about the environment of infection. It's in a photography studio. For the photography training, in such a training place, there is very poor ventilation and a cluster of people. They didn't have any prevention and control measures in place. So that's a reminder. Individually, we must always be alert about epidemic control and prevention. On a daily basis, when we go out, we must observe those prevention and control measures. If you go out together with your whole family, you will be meeting more people and there will be a cluster of population. That's why the individual measures about prevention and control of the epidemic must be monitored and implemented. Next question, please. Thank you from China Daily. According to the guideline of vaccination, the shortest period between 2 doses of the vaccine is 8 weeks. If it's beyond 8 weeks, does it mean that the vaccines will lose their potency? Mr. Wang Huaqing, please. Thank you for the question. Actually, the issue must be solved based on one same principle. If you have to take 2 doses or 3 doses of this vaccine, then between 2 doses there must be a period. Usually, you can accomplish the doses according to the requirements if the time lingers on beyond the required period between 2 doses. Actually, the vaccines must be still potent. According to the technical guideline, as you've mentioned, particularly the inactivated vaccines, between the 2 doses, the period must be no more than 8 weeks. So if it goes beyond 8 weeks, we don't have to restart the first dose. As long as you are injected with the second dose, it's okay. Of course, we advise the public to accomplish the several doses within the requirement. Next question, please. Thank you from Hong Kong. Now, the situation of epidemic control is quite severe, and Guangdong province is a big province of international cooperation. So what is the situation of preventing any imported case, and what are the measures taken in the process of international cooperation? Mr. Duan Yufei, please. Thank you for the questions. During this time, Guangdong has received the largest number of inbound visitors. Guangdong contributes to 90% of receiving those inbound visitors every day, and there are 300 installation sites, and there are around 30,000 quarantined people in those sites. and we will strictly abide by the requirement of 14 days of quarantine time to avoid any safety threat to other people. As to preventing the import cases, the certain entities in our province will prevent in terms of the people and environment, and the Greater Bay Area work together for the joint prevention and control, and we also have built a closed loop. So the red line has been circled to cover both the homes and the provinces. As to the closed loop, we have worked on the quarantine sites, the hospitals, communities, the fever clinics, and also the ports. We strictly implement the health screening of those inbound visitors, including nucleic acid testing. And also we have a health code for any incoming visitor. They must share with us about their health code throughout the process. As I said, for all of those incomers to Guangdong province, we will have a quarantine according to the national requirement. And secondly, for the prioritized groups, we manage their health. For those staff members in the port, the quarantined hotel staff members, the inbound visitors, and the workers to transport the goods, we will pull them together for nucleic acid testing, and all of the prioritized groups will have been tested, and such a testing is done weekly. Among those prioritized groups, the truck drivers who drove across borders is also the difficult group for our screening. Every day in the ports, there are about 6,000 truck drivers. So we must file their information and scan their health code, and the point-to-point transportation must be managed. There are 8 measures for cross-border transportation control. Their residence, their working place must be managed in a closed loop, and we must implement the co-prevention measures in the Greater Bay Area, for example, to cover the fishermen and the cargo workers. Now, the information will be mutually accepted in the Greater Bay Area, so the data has been shared and the measures are the same. Within 7 days, the nucleic acid testing result can be accepted in those localities. As long as it's negative, then they can have a free flow in the Greater Bay Area. And for the goods, environment, and population, we screen them all. We also cover cold chain enterprises, the direct contacts of the cold chain, and we also screen and test the environment. There will be daily cleansing, ventilation, and we continue to work on the aquatic products and the meat for the safety concerns. Thank you. Next question, please. From Shenzhen TV. It's also a question about Guangdong. Mr. Duan, as a big province of international cooperation, asymptomatic carriers and newly occurring cases are still in large numbers. So what are the measures about medical rescue and treatment? Thank you for your questions. Guangdong province has been cementing our system of medical treatment so that the treatment target, mechanism, and efforts are never fading away. And since then, there has been 0 deaths, 0 infection. And as to the measures, firstly, we enhance the designated hospitals management. Since the joint prevention and control mechanism has become a routine work, we have designated certain hospitals. and stepped up their management. Now, for the provincial level designated treatment hospitals, there are 3 of them, and at the municipal level, there are 32 hospitals. For every county, there will be a backup designated hospital as well. So that's about cementing the system of designated hospitals. And secondly, we have made a management list of those hospitals. As long as you are a designated hospital, there are 50 rules to abide by. We organize the experts and medics for emergency dispatching in order to have a dynamic management of the resources. And secondly, we improve our expert team. We have divided our whole province into 7 regions, and the experts will be assigned to a certain region. There will be 8 to 11 experts in one region, and there will also be the secondary expert groups to cover imaging, infectious disease, and verification departments. So there are 3 different layers of experts. Thirdly, regular appointment with doctors. We have set up online appointment services. The provincial level experts will have distant interview with the patients and give particular guidance to the confirmed cases. We dispatch the leader of the expert team to offer instant face-to-face communication with the severe cases, and there will be on-site treatment. We also dispatch the specialists to take in charge of the severe cases. Fourthly, the firewall is built in the hospitals to prevent infection. The municipal level leaders, the health leaders, and the medical staff, responsible people will hold themselves accountable at provincial and municipal level. They have signed up for their responsibilities. As long as any problem occurs, they will be held accountable. There are 158 different guidelines, and there also has been a chief mechanism. So for the key groups, nucleic testing will be carried out completely, and the medics staff must be trained. Thank you for all the questions today, but in the interest of time, we can allow for 2 last questions. Thank you from People's Daily. For the mutating viruses in India, do we have a research conclusion yet? What is the severity of those mutating viruses? Mr. Wu Zunyo, please. Thank you for your question. Since the COVID-19 broke out, the World Health Organization put in place a website to monitor the mutation of viruses globally. Countries across the globe will submit the information of the mutating viruses to the website. On the website, we can see that there are 3,000 variations of the virus in India. For the reported and monitored viruses, they take up only a small portion of the actual conditions, which means in India, the actual number of mutating viruses may be far over 3,000. The virus mutation is in large numbers, but does it mean that the larger the number of mutation, the more dangerous it is? It's not. It depends on the nature of the variation. The minor mutation doesn't attract our attention. And according to WHO, there are 3 types of mutation. For the first type, it worth our special attention and vigilance. For example, the mutation in UK, South Africa, and Brazil. For the second type, it's worth our attention, but not vigilance. For example, the variation in India. They worth our attention, but for the others, we don't have to pay even attention. Thank you. The last question, please. Thank you from Hongxin News. Once the general public are receiving the vaccines, they have discovered some particles in the vaccines, usually the floccules. So does it mean that it's a quality issue? Thank you for the question. Before the vaccines made in China being released to the market, there must be several rounds of testing. Firstly, self-testing by the producer according to the national requirements. Once qualified, they will report the products to the national agency and the third-party agency. Once standardized in the second round of testing, the NMPA must have the third round of testing before releasing the products to the market. As to the appearance of the vaccines, there must be some science promotion. Of course, the vaccine doesn't need to be purely clear as the mineral water. After all, the vaccines and the agents are in the fluids. So, between the agents, there will be the white-colored liquids, and there will be different layers of the liquids. One, the vaccine is put in a static motion. So, because of the sediments, those agents might be divided up to different layers, and they look in white colors, but they are qualified products. So please be reassured. As I said, there are several rounds of testing. And please allow me to add that before the products are released, there will be a machine-based testing as to the purity of the vaccines, and also the staff members will use their naked eyes to review the vaccines. So as long as there is any problem of the vaccines, they will be discovered in the process of review. As long as you receive the vaccines in the sites, they are up to the standard. Thank you, our experts. So in today's press conference, all our experts have taken over 20 questions from the reporters. And that's actually breaking our historical record since we started the Joint Prevention and Control Mechanism press conference. It demonstrates that people are highly concerned about the updates of epidemic prevention and control. I would love to give my thanks to all the experts and our reporters. In the future, there will be other press conferences to answer your concerns. Thank you all for your participation.